Welcome to the AI Nurse. Before we begin, a quick disclaimer. This is not medical advice. Consult your healthcare provider for serious concerns. Today, we're discussing what to expect with lens and cataract procedures. A cataract is a clouding of the eye's natural lens, which can make your vision blurry, dim, or like looking through a frosty window. Surgery is the only way to treat them. Before surgery, your doctor will measure your eye to determine the right replacement lens. You might also be prescribed antibiotic or anti-inflammatory eye drops to start a few days prior. You'll choose an intraocular lens, or IOL. Monofocal lenses provide clear vision at one distance, while multifocal or toric lenses can address presbyopia or astigmatism. On the day of the procedure, you'll likely need to fast for several hours. Since you'll be given a sedative, make sure you have someone to drive you home afterward. The surgery itself is usually performed as an outpatient procedure and takes about 15 to 30 minutes. You'll be awake, but your eye will be completely numbed. The surgeon uses ultrasound energy to break up the cloudy lens into tiny fragments, which are then gently suctioned out through a microscopic incision. Once the cataract is removed, the clear artificial lens is inserted into the same capsule that held your natural lens. No stitches are usually required. After surgery, you'll rest in a recovery area for about an hour. Your vision might be blurry or wavy at first, but this is completely normal as your eye begins to heal. You'll likely wear a protective eye shield for the first day and while sleeping for about a week to prevent any accidental rubbing or pressure on the eye. For the first week, avoid heavy lifting, strenuous exercise, and bending below the waist. Also, stay away from swimming pools and hot tubs to avoid infection. You will have a strict schedule of eye drops to prevent infection and control inflammation. It is vital to follow your surgeon's instructions exactly. It's normal to feel some grittiness, mild redness, or light sensitivity in the first few days. Your vision should start clearing up significantly within a week. However, call your doctor immediately if you experience severe pain, sudden vision loss, or see flashes of light or many new floaters. These can be signs of complications. Most patients have follow-up appointments the next day, after 1 week, and after 1 month. These are essential to ensure the eye is healing properly and the lens is stable. The results are typically long-lasting. Colors will appear brighter, and your overall quality of life often improves dramatically once both eyes are treated. In summary, cataract surgery is one of the safest and most common procedures performed today. Preparation and careful recovery are key to a successful outcome. Do you or a loved one have questions about this procedure? Drop them in the comments below. I'd love to hear from you and help clarify the process. If you found this helpful, please like, subscribe, and hit the bell for more insights on AI in healthcare. I'm the AI Nurse, and I'll see you in the next video.